Mr. President, welcome to the Senate. It is a pleasure to have you joining this body, and I will tell you that ever since the health care law has been passed, I come to the floor every week as a physician, as someone who's practiced medicine for a quarter of a century, taking care of families across the state of Wyoming, to give a doctor's second opinion about the health care law. And I bring that each week, bringing a different story of someone who has not been helped by the health care law, someone who has been hurt by the health care law, an identifiable victim of the health care law. And I heard it certainly at home over Thanksgiving from doctors and nurses as well as from patients, because I believe that this is a law that is going to be bad for patients, bad for our providers, the nurses and the doctors who take care of those patients, as well as bad for taxpayers. And then it's been no surprise to me, Mr. President, that Americans want and expect repeal of this health care law. The most recent Rasmussen poll showed that Americans support repeal of Obamacare by a margin of 21%. 58% are for repeal, and 37% are not. Independent voters support repeal by 24 percentage points, 59 to 35%. So I continue to come to the floor to bring out to our colleagues the concerns that I have about the health care law and the concerns that I hear at home from patients and from providers and from taxpayers. And what I wanted to mention to you today, Mr. President, is that recently the Secretary of Health and Human Services, Kathleen Sebelius, sent a letter to members of the medical school class of 2014. These would be the incoming medical students, the first-year medical students in your state and for mine. And in the letter that goes to about 15 or 16,000 first-year medical students, she talks about this the health care law, and talks about how she believes it will be good for them as medical students and good for their patients. Well, one of the things that she talks about in the letter, interestingly enough, is that she said many of you and your siblings are undoubtedly, she says, under the age of 26, as many first-year medical students are under the age of 26. And she then raises the issue that says, you will now be able to stay on your family's insurance policies until you are 26. As you know, Mr. President, this was one of the selling points behind this health care law, that young people would be able to stay on their insurance policies until the age of 26, and the Secretary points that out to all incoming medical students. So it, I think, came as quite a surprise, Mr. President. It did to me, and I think it should have to these medical students and to others, to read a story in November 20th in the Wall Street Journal that talks about, the headline is, "Union Drops Health Coverage for Workers' Children." The idea was that children were supposed to be covered under this health care law. And I will just start by reading, Mr. President, one of the largest union-administered health insurance funds in New York, one of the largest union-administered health insurance funds in New York is dropping coverage for the children of more than 30,000 low-wage home attendants, union officials say. This is the Service Employees International Union, and they are dropping coverage for about 6,000 children. The President has said no children will be dropped. The Secretary has said no children will be dropped, and yet a union which has encouraged, through its lobbying efforts, support of the health care law is now dropping 6,000 children. And why are they doing it? Well, it says that the health care reform legislation requires plans with dependent coverage to expand the coverage up to age 26. And what they say is, quote, "Our limited resources are already stretched as far as possible, and meeting this new requirement would be financially impossible." Well, Mr. President, during the entire debate on the health care law, people have said that many of these rules and regulations and requirements are going to be financially demanding. But yet this body, before you've arrived, this body crammed this law, at the time of bill, down the throats of the American people that don't want it, don't like it, ask that it be repealed and replaced. And now even one of the unions that lobbied for it is saying we're not going to cover 6,000, actually going to drop 6,000 children who had previously been covered because the legislation, they say, would be financially impossible to comply with. So, Mr. President, I looked at the Secretary's letter, looked at this response, and Tom Coburn, another physician in the Senate, and I had a lot of concerns about the letter that the Secretary sent to the medical students of this country. So we also sent a letter, an open letter to American medical students in the first year of their medical school. And what we wanted to do was first actually congratulate these young men and women, congratulate them on their dedication. They're dedicating their time and their talent and their skill, and they're doing it in the service to others. And we talked about the importance as physicians, as medical students, to truly listen to their patients. Because one of the basic tenets of medicine is nothing should come between a doctor and his or her patients. It's important for them to be able to have the time to listen, to focus, and to spend time and not allow anyone or anything to come between the doctor and the patient. And yet we passed a health care law that puts Washington and faceless bureaucrats between the doctor and the patient. We talked about the significant change in the doctor-patient relationship in this letter that Senator Coburn and I sent to medical students, and our concerns that Washington is now going to have more power to determine the care that these medical students and future doctors are going to be able to deliver to their patients. We talked about 150 new government regulating bodies coming out as a result of this 2,700-page bill, and they are going to intrude upon the doctor-patient relationship. We talked about our concerns about what's called cookbook medicine. Follow these rules because of the new authorities that have been provided by this 150 new bodies that has been created by the law, and that decisions are going to be made based on cost rather than on what may be best for the individual patients. The President continues to talk about providing coverage for more people. Well, Mr. President, there's a lot of difference between coverage and care. And that's why when a leader in Saudi Arabia had a recent health problem within the last 2 weeks, he chose to come to the United States because it's the best care in the world. The World Health Organization may have someone else listed at number one, but the ruler from Saudi Arabia decided to come to the United States. Didn't go to Cuba, didn't go to England, didn't go to Canada, came here for the care. We want the young men and women who are in medicine, going into medicine, training in medicine, to be able to provide that kind of care, and we want the American people to continue to receive that kind of care. Unfortunately, in this body, political passion overtook good policy, and a law was passed that I think is not going to be good for patients or for providers or for those people that are paying the bill. And so that's what I hear every weekend at home in Wyoming. It may be what you hear as well, and I know you have heard that in your home state. But yet the President of the United States had a wide-ranging interview with Barbara Walters the other evening on television, and what he described as this health care law, he said he was extraordinarily proud of health care reform. What I consider a health spending bill, he calls a lasting legacy, he said that, quote, I am extraordinarily proud of. Well, Mr. President, that's why I was surprised to see the headline in the Washington Post, which I believe was the same day, actually, as the President's interview with Barbara Walters, and the Washington Post, Friday, November 26th, the headline, front page, doctors say Medicare cuts forcing them to shift away from elderly. Medicare cuts forcing them to shift away from elderly. It's what we talked about during the debate on the floor of this Senate when that health care law was being debated, that they've taken $500 billion away from Medicare, not to save Medicare, not to help our seniors, not to extend the life of Medicare, but no, to start a whole new government program. And that's why, Mr. President, every week I come to the floor to offer a doctor's second opinion and share with you, as well as all of those in this chamber and the American people, why I believe, as a doctor who's practiced medicine for a long, long time, that this is a health care law that we need to repeal and replace with something that is good for patients and good for providers and good for the taxpayers of this country. And with that, Mr. President, thank you, and I yield the floor.